T-plate for proximal tibial fractures. It's in my experience, and me and my colleagues in Mashhad University of Iran. As you know, proximal tibial fracture are complex injuries and a big challenge for orthopedic surgeons still. Question of our research is that does LCP plate, that's a new generation of fracture fixation, provide better result for proximal tibial fracture than T-buttress plates that are conventional fixations. In a prospective randomized study, we operated on 62 patients with proximal tibial fracture that they had extension to knee joint. 51 men and 11 women. Our LCP group consisted of 27 patients, and our T-plate group were 35 patients. Our inclusion criteria were unilateral proximal tibial fracture and proximal tibial fracture that extends to the joint. And our exclusions were immature skeleton, systemic disease, something like diabetes, and open fracture or neurovascular injury. Our patient, according to Schatzki's classification, were, as you see, the most common type were type 3 in both group, in the LCP group and T-plate. We had 10 patients in the LCP group, and in T-plate group, 15 patients of the cases, about 70% of patients. Our average follow-up was 24 months from 18 months to 3 years. And we regarded malunion as 5 degrees valgus or varus and 2 millimeters of steps. When we had a fracture that is not united after 6 months, we calculated it as a non-union of the patient with LCP plate, and one more, and one patient with T convention plates. Our results were no case of non-union in LCP group and just 2 cases of non-union in T-plates that we treated with bone graft successfully. One malunion and 1 malunion in LCP group, but 6 patients with T-plate in T-plate group. We had just 1 infection in LCP group, but 4 cases of infection in T-plate group. But there were some superficial infection that we treated with drainage and debridement. We had 3 cases of knee stiffness after the surgery in our follow-up in LCP group, but 4 cases in T-plate group. Our conclusion is that LCP patients had significantly lower rate of malunion and infection than T-plates, but insignificant rate of non-union and knee stiffness. We know our limitation in this study, that our sample was small and our follow-up was short. Thank you very much.